We merge all the knowledge about these three parts. And we especially focus on the role played by the signaling molecules. And I'm arriving to the core of the seminar. These are called signaling molecules. Sometimes in literature you will read them as messenger molecules. Why? They are the substances able to bring the right instruction to a cell to make the cell working correctly. And they are cytokines, neuropeptides, hormones and growth factors. You can see that I wrote for each low dose, low dose, low dose, low dose, because to have them working physiologically, you must have in your body or use as medication in a very low dose, in a very precise low dose that I will show you. To understand the role played by the signaling molecules for the cure of many diseases, I am used to refer to the concept of psycho-neuroendocrine immunology. It was developed by Robert Adler in the early 80s in the United States, in New York. To understand the PNEI paradigm, I ask you to refer this concept to other two concepts that are homeostasis and crosstalk. Let's go to understand why homeostasis is so important to understand the paradigm of PNEI. Homeostasis is the capability of the body to maintain into a precise range the value of some vital parameters. For instance, glycemia between 60 and 110, more or less. Oxygenation, saturation of the blood around 98%. pH, my God, how much important is pH in controlling the physiology? At the level of the extracellular matrix, pH has to be between 7 and 7.2.3. Lower acidosis, higher alkalosis. It controls, by a metabolic point of view, for instance, inflammatory processes. Temperature. Our temperature has to be 36, 37. Normally, in medicine, in conventional pharmacology, we are used to use medications that directly act on the vital parameters, and that's good, but it's mainly a symptomatic activity. Instead, why not to focus on PNEI? These are the three main homeostatic control systems: central nervous system and autonomic system, endocrine system, immune system. Physiology call them homeostatic control system. Just to have an idea, they are the big brother. Orwell, 1984, you remember the novel. Okay, PNEI is like a big brother. It controls everything. It controls the vital parameters. So, will be absolutely outstanding a medicine that not only will be in the position to act directly on the vital parameters, but also acting on the origin of the disorder in the vital parameters. That is the three main homeostatic control systems. Yes, easy, Alessandro, wonderful, but how can I interfere with the three main homeostatic control systems? How can I talk to them? with the only language that the central nervous system, the endocrine system, and the immune system are able to understand. Signaling molecules. They are the words used by the three main homeostatic control systems to talk each other and to understand each other. When they are not more in the position to speak to each other and to understand each other, that's the origin of the disease. To reestablish a right communication is to reestablish the physiology. This is the target of our therapy. So, first concept to understand the PNEI.